In your book, Surgery, the Ultimate Placebo, chapter one is called The Placebo Effect. What is the placebo effect and how does it work? What was this about?
Yeah, that's a good question. It's actually a difficult concept. Most people understand the idea of a placebo pill. You know, the idea that you could take something that doesn't actually do anything in itself, but might still have some effect. When it comes to placebo surgery, it's a lot more difficult for people to understand the concept that you would do an operation on somebody that would not actually do anything. Um, but that's actually what we're talking about. We're talking about operations that are done on people that don't have an effect in themselves. And then we have to explain why the patient felt better afterwards. Um, Now, some people call that the placebo effect. Um, but really it's due to lots of different things, and the reason why somebody may feel better after surgery could be, for example, that they would have felt better anyway even if they had not had the surgery. So for self-limiting conditions or conditions that kind of get better anyway, um, it's a classic example would be a condition called tennis elbow. Most people have heard of that, they know what that is. And for a long time, we did lots of operations on people with tennis elbow. We did different kinds of surgeries to try and fix this tennis elbow problem. And the surgeries, by and large, worked. And that's because if you don't do anything to tennis elbow, if you do absolutely nothing to the patient, 98% of them will get better within 12 months. And so surgery, so people can call that a placebo effect of the surgery, but you could also call it a no effect of the surgery. But either way, it's this problem where people get better, but it's not due to the surgery. And so that's what I've kind of defined as the placebo effect for the sake of argument during the book.
In your book, Surgery, the Ultimate Placebo, chapter two is called The Science of Medicine or Lack of It. What makes good science? What was this about?
This chapter was really, it had to be put in there because this is the answer to everything, and the way we answer questions in the world today is by using science. I wouldn't have thought that that was really very contentious. I would have thought that most people would understand that, but it's surprising how people misread science. And for instance, there's lots of examples where science has got it wrong, you know, for sure. And so the conclusion that some people have then is that, oh, science is bad. Science is not a good way of knowing things because it's often wrong. Um, but in the book as well, I often paraphrase Winston Churchill, who said of democracy that democracy was the worst system of government except for all the others. And so I kind of say that science is the worst way of knowing things, except all the others, except for all the other ways. But by definition, science is a method of error reduction. It doesn't always give you the right answer, but if you do it properly, it will give you the least wrong answer. So it's kind of like the best we've got. And so I spend that chapter just sort of defining what science is and explaining why we should rely on it. You know, when we're trying to work out whether things work or not.
In your book, Surgery, the Ultimate Placebo, chapter three is called Building the Perfect Placebo. What makes a good placebo? What was this about?
Yeah, so this chapter just describes the evidence that we have and the experiments that have been done looking at placebo responses. And so, for example, even within placebo pills, we know that the size of the pill can have a stronger effect. The color of the pill can have a different effect. We know that two pills are stronger than one pill in regards to the placebo effect. And if people are made to believe that the pill is an expensive pill, it has a stronger effect than if they believe it to be a cheap pill. And then going on from pills, we know that more invasive things like injections have a stronger effect than pills. And so if you, this is the argument of the book, if you were to build the ultimate placebo, it would be something that would be very invasive, it would be very expensive, it would involve devices, implants, and basically surgery would be kind of the ultimate placebo.
In your book, Surgery, the Ultimate Placebo, chapter 4 is called Putting Surgery to the Placebo Test, Examples of Studies Using Sham Surgery. What was this about?
Yeah, so again, comparing it to pills, most people know and understand that to test a new drug or a new pill, you would compare it to a pretend pill. You would do a placebo-controlled study to find out whether that pill works. And most people know that that's probably the best way of finding out whether it works or not, because everything else is the same. The only difference between the two groups in such a study is that one got the real drug and one didn't get the real drug. And so any response difference you see is due to the drug. But people don't think that that's a doable thing in surgery. That myth has been busted a lot in, I'd say, the last 10 years, but not much more than that. And it's really only sort of in this century that placebo surgery studies have been more common and more routine. And this idea of doing an operation where half the patients will get the real operation and half the patients will get a pretend operation sounds very scary. It's like, how could you do something like that? When you think of it scientifically, that's the best way. Like, there's no better way of finding out whether the surgery works or not than doing that. And people argue, they say, well, that's unethical. But there's a whole argument to be had there, because I would argue that what's unethical is doing surgery on people when we don't know if it works or not. That's unethical. Finding out if it works or not is ethical. And then you can apply it or not apply it to all millions of patients in the future. And so I described some of the tests that have been done. And interestingly, when a lot of procedures are put to the placebo test, procedures that we thought were effective suddenly are being shown to be completely ineffective or no better than placebo. And this has driven the demand for maybe more tests like this on surgery. Why haven't we been doing more in the past? That kind of thing.